Hello, everyone, and welcome to Johnny's Ambassadors Expert Webinar Series for Parents. I'm your host, Laura Stack, the founder and CEO of Johnny's Ambassadors, where we educate parents and teens about the dangers of today's high-potency THC products on adolescent brain development, mental illness, and suicide. We have another wonderful guest with us here today, whom I will introduce in just a moment after a couple quick logistical details. This session is being recorded. Please share it with your friends and family. Dr. Riggs has kindly provided several handouts for you today, which you can find either on the page where you're listening to this or in your control panel if you are here live under the section marked Handouts. She has given us her slides as well as 2 additional educational toolkits for your use. She will be taking your questions at the end live. She will do her slides for about 45 minutes and have 10 or 15 minutes or so left over at the top of the hour to take your questions. So please type them into the question box as you think of them so you don't forget your question, and I will read those off to her at the end. So without any further ado, I am so pleased to introduce Paula Riggs Md, who is a professor and vice chair of Faculty Affairs, Department of Psychiatry, University of Colorado School of Medicine. As the director of the Division of Substance Dependence, she conducts and oversees a broad range of NIH-funded addiction research projects conducted by division research faculty. She also provides administrative oversight for a large number of community-based adult and adolescent addiction treatment programs, collectively known as Addiction Research and Treatment Services, or ARTS. Dr. Riggs is nationally known for her research and clinical expertise in adolescents with co-occurring psychiatric and substance use disorders. Paula, thank you so much for being one of Johnny's ambassadors.
Thank you, Laura, for that introduction, and I'm happy to be here. And I'm going to focus today on the effects and the impact of cannabis legalization, and also the health and the mental health effects of using cannabis during adolescence. So parents need to know this, and other concerned adults need to know what the research is showing in this regard. And let me just start with my disclosures as the developer of an executive director of Encompass, which is a unique evidence-based integrated mental health substance treatment program known as Encompass. And also I have research grant funding from the National Institute on Drug Abuse. And the learning objectives for this presentation are to better understand the risks associated with marijuana use during adolescent development and what the impact of this growing cannabis legalization environment, kind of the impact of that on adolescent use patterns and frequency, as well as the impact of regular marijuana use during adolescence on health, brain development, mental health, and psychosocial outcomes. And then what are the resources for where can parents find evidence-based treatments for cannabis and other substance use disorders? So I'll just start by saying that both addiction and mental illness are largely pediatric onset. That is, 50% of psychiatric disorders start before the age of 15 and about 3/4 before the age of 24. And we also know that most adults who suffer from chronic issues with addiction, they started using during adolescence, and about 8 out of 10 people ages 12 and older are addicted to drugs and alcohol in the US. And the thing I want you to kind of wrap your head around is that most of the psychiatric disorders that do have an onset in childhood, to some extent, increase the risk of developing an adolescent onset substance use disorder, and they travel together. In other words, most kids who end up coming to me or in community-based substance treatment programs also have at least one co-occurring psychiatric disorder, and that's an important fact that I'll come back to. Now, Laura, you're seeing the advancement of the slide, so I'm hoping you can see this slide.
Yes, everything is going beautifully.
Perfectly, thank you. I know this is a complicated slide, but what I want you to focus on is, so across development from birth to, so let's say into ages mid-20s, we have a period 10 to 20, actually mid-20s, of rapid brain development in adolescence. And I mentioned that there are many psychiatric disorders that have an onset typically during childhood, such as attention deficit hyperactivity disorder, depression, other mood disorders, bipolar, anxiety disorders, and to some extent, they also increase the risk of developing adolescent onset substance use disorders. And the biggie right now is cannabis. I mean, yes, alcohol is still very significant, but with the rising potency and the availability of cannabis, our kids are becoming increasingly addicted to cannabis, and it's having pretty significant consequences. So we know that about 60% of adolescents in community-based substance treatment, as I mentioned, have at least one co-occurring psychiatric disorder. And this is really important. That is, in general, well, the answer is yes. If someone asks, is marijuana addictive? The answer is unequivocally, based on science, all the research, it's addictive. Absolutely. 1 out of 11 adults who experiments or uses cannabis will progress to become addicted or dependent, but 1 out of 6 teens who experiment and use marijuana will progress to become addicted to it, have a cannabis use disorder. And that means they are more vulnerable. Adolescents are more vulnerable to become addicted than adults. And there's growing evidence that it is a gateway drug to this extent. That is, using marijuana regularly actually primes the brain or kindles the brain, if you will, so that other drugs tried later, they are more likely to become addicted to other drugs tried later, such as opioids and others. So that's an important thing to know about. And with the rising potency of cannabis, what we've learned is this really increases the risk of psychosis. It at least quadruples the risk of first onset or initial onset psychosis. It increases suicide risk. It doubles your risk of depression, anxiety, especially arising in young adulthood. And we know that weekly to daily use of cannabis has been associated with persistent neurocognitive deficits and reductions of 6 to 8 points in adult IQ that we're not certain, even with abstinence, are fully reversible. That's a big hit. So just want to mention that the reason that cannabis is essentially neurotoxic to adolescent brain development is because the THC, the tetrahydrocannabidiol, the active and psychoactive ingredient in marijuana, binds to a receptor in your brain, the cannabis 1 CB1 receptor. And that receptor is primarily responsible for the regulation of the development of the business end of your brain, your prefrontal cortex. So during adolescent brain development, in kids, you don't have, here's like your striatum is that portion in your brain. Some have called it the reptilian center of the brain, where it's sort of you can, drugs, rock and roll part. It's your impulsivity, it's your reward center. And in younger children, neither this center is not hooked up to the prefrontal cortex, and the prefrontal cortex isn't hooked up to this. And during adolescence, the limbic system, the reward or the impulsivity and that drive, that's actually myelinated or linked up to the prefrontal cortex before the prefrontal cortex is wired back to override those limbic impulses. If you want to wrap your head around, this is what it looks like in adulthood as a cartoon. If you want to wrap your head around this, think of yourself at age 15. Now think of yourself at age 25. And pretty much the difference between you at 15 and 25 is what hooking up this circuit did for you. It's like, maybe we don't want it. Maybe I don't want to do that. That's a little risky. So that's regular. That's just what happens in brain development during adolescence. Cannabis and other substances interfere with that development. And the other point, the take-home point here, not only does substance use interfere with brain development, it increases the risk of chronic addiction and other mental health problems. It complicates the clinical management of any pre-existing mental illness or psychiatric disorders, and it contributes to the development of new psychiatric disorders. That's the take-home point. Second take-home here is important, is all the neuroimaging and neurophysiologists, they would say that what teens do during adolescent years, predominant activities they're involved in and during adolescence shapes the way your brain develops. If you're playing sports or you're playing video games, if, you know, and it's not quite this simple, use it or lose it, but it's sort of like, you know, hey, do you think we're going to be using these synapses for physics or piano lessons? No, we haven't used them so far. All right, I'm going to prune these away. It shapes the way your brain develops into adulthood, and it's really important. So one of the most important preventive things that parents or pediatric primary care clinicians can do is get kids involved in pro-social, non-drug activities that they really love, that carry them through adolescence, and that's protective. But let me just say, here's what I was referring to before. That is, our brains make a chemical called anandamide, and it looks very similar to the active psychoactive ingredient that makes you high in marijuana, the THC. Very similar. That's why this binds to the receptor, the CB1 receptor, that this was made to do. But it's okay if this is bound to it. When this is bound to it, it interferes with brain development. And you can see these cannabis receptors are everywhere in the brain, except they're not in the visual cortex, which is why using marijuana is not typically associated with visual hallucinations, but it is associated with problems in decision making, judgment, abstract reasoning. It really messes with memory, the hippocampus, where you can't convert short-term memory into long-term memory. And those memory problems can persist in adolescence. Movement, it makes you uncoordinated, being high on marijuana, and also gives you a variety of different sensations. So they're located everywhere in the brain except for the visual cortex. That's why it has the effects that it does. And so it also causes, when you are using regularly, especially during adolescence, it reduces the volume of the hippocampus and the brain volume of other areas of the brain involved in learning, memory, stress, and inhibitory control. Decreases cognitive performance, learning, memory, attention problems, inhibiting those impulsive drives, and the speed of information processing and reaction time. All are impaired or reduced. And at least one large study showed reductions in adult IQ. And we know that more than one study, several studies now have shown that regular use during adolescence causes persistent neurocognitive deficits. But here's also a very important study, and others have corroborated since, and that is there is a dose-related relationship between the times kids have used, you know, starting between ages 14 and 21, the number of occasions they've used cannabis from never, 1 to 99, 100 to 199, 200, 300 to 399, etc. You can see this almost stair-step progression of the relationship between the number of times you've used during adolescence and poor psychosocial outcomes. So that is, compared to non-using peers, adolescents who use marijuana are more likely to drop out of high school, have decreased life satisfaction, poor mental and physical health, memory problems, relationship problems, lower salaries, and less career success, less likely to graduate from college, and more likely of being unemployed or underemployed. And so the bottom line is just not going to go as far in life as they otherwise could have, smoking a lot of marijuana during adolescence. And this is a problem because so now you know about the vaping sort of epidemic. And the good news is at least daily or near daily marijuana use amongst 8th, 10th graders, 12th graders has dropped a little bit. And that's good news. But still what we have is marijuana use remains steady. So we're still early on in sort of this growing marijuana legalized environment. But so far, it looks like it's not necessarily driving a lot of increased prevalence of use amongst adolescents, but it's still very high given the neurotoxicity I mentioned. That is, past year marijuana use amongst 8th graders is more than 10%. It's almost 30% in 10th graders, And more than a third of high school seniors have used or tried marijuana in the past year. And daily or near daily use is about 7% amongst high school seniors. So about 1 out of 17 are using every day or multiple times per day. And similarly, 4.4% of 10th graders and 1.1% of 8th graders. That's a significant number of kids. Good news is alcohol use and binge drinking has declined somewhat, but still, this is the number. Almost 17% of high school seniors have had an episode of binge drinking, which means 5 or more drinks in a row in the past 2 weeks, in the past 2 weeks before the survey. And those were just the kids who were in school that day, right? So it's probably more closer to 20% binge drinking. And that's a real problem because that's the dangerous level of it. And more than half of high school seniors are using or have been using, certainly say that they have been in the past year. So let's talk a little about the impact of legalization. And certainly, I don't know where all of you live. I'm right in the eye of the hurricane. I'm living in Colorado and have been throughout this whole legalization thing. And across the country, those states that have legalized medical and then within about 2 years, recreational cannabis, it's reducing the price of the cannabis and it's increasing access both for adults and adolescents to very high potency marijuana. These legalized states have more first-time adults and adolescents who are using cannabis. So it's not just, it was really never about this legalization, it was never about just decriminalizing. It was about expanding access and marketing. And so it's not just decriminalizing it for the people who were using before, it's certainly recruiting new adult and adolescent users. And although there's no consistent increase in the prevalence of adolescent cannabis use, which is already high, the concerning trend is it is driving an increase in their use and the market share of concentrates, which are very high potency cannabis products. And it's increasing marijuana-related motor vehicle accidents, fatal crashes, emergency room visits, hospitalizations, calls to poison centers, and marijuana-related suicides, all going up in legalized states. And certainly that's true in Colorado. I want to show you what I mean by, you often hear people say, well, the cannabis today is not the marijuana of Woodstock or our parents or grandparents. And that is certainly true. That is back in the 60s, the average joint had 3% THC in it. And it slowly crept up just incrementally to early 2000s, about 4 to 6%. Now, in a legalized, well, this is data just to 2016. Now it's about 25%. An average smoked joint or blunt has about 25% THC. That is multifold times greater concentration. But concerning is this business of the concentrates. You've heard of shatter, wax, dabs, butane hash oil. They are upwards 70, 80, above 90% THC concentration. And that is such a super physiologic dose. We're just now beginning to see research coming forward to show us what the impact is. But what we do know is the higher the potency, the greater is the abuse liability or addictive potential. Kids who try these high potency things and adults become addicted or progress to regular or daily use much more quickly than the lower potency stuff that we had way back when. It also, the higher the potency, the greater is the risk of psychosis. And that is especially in adolescents. And even if you have no risk factors or genetic risk factors for schizophrenia, it can still cause psychosis. It can quadruple the risk of a first episode psychosis. And that is no joke. And the more regular, it's a 50 times greater risk of psychosis in daily marijuana users who are adolescents compared to non-daily users. So it's a big risk. And what we're seeing is this business, these are data from Colorado that we collect annually, and we've seen from 2015 to 2017, we saw a jump, and this trend has continued where we're seeing an increase, steady increase in students who use marijuana the percentage who dab or use these highly concentrated forms of waxes, shatter, etc. And among students who use marijuana in the past 30 days, we're seeing a rise in the number who are using edibles. And edibles, have you eat a cookie or a brownie or whatever, a lollipop with THC in it, and it takes about 45 minutes, an hour for you to feel the effects. So it's like, oh, hey, don't feel much. You eat the whole thing. It's edibles that have been associated with this psychosis risk even more than, well, as much as the concentrates, because you can't titrate or control the dose once you've taken it in. The impact of marijuana legalization in Colorado, for example, we passed legislation for recreational legalization in 2013, but the doors of the first dispensaries selling recreational didn't open until January 1st of 2014. And what we've seen is the number of suicides positive for marijuana in ages 10 to 19-year-olds shot up after that. And it's come down a bit, but it's still high. And similarly, 20 and older, suicides that have marijuana on board. Now that's association. It doesn't mean it causes it, but we're increasingly concerned. We do know that especially high potency cannabis causes very frequently paranoia and often suicidal ideation. So we're thinking that it's more than just an association, but more research is needed to see if there's a causal link. But what we've seen is a 45% in just 3 years post legalization, an increase in past month use. We're third in the nation right now, and we're 85% above the national average for ages 12 and older just using marijuana. Amongst college age, 18% increase. We're 60% above national average, and we've seen a bump in adolescent use in a state that was already at a high level. And 48% of marijuana users in Colorado say they go to work high, and 40% of those say at least once a week. So it's really having a public health impact. And there's been a 170% fold increase in youth emergency room or urgent care visits of marijuana related illnesses. And much of that is what is called a hyperemesis syndrome, as well as psychosis that we're seeing a lot more of. Hyperemesis is uncontrolled, you can't control vomiting. That is clearly associated with cannabis use. And I've seen personally referred to me 4 or 5 kids who have had multiple ER visits in the past year, and then and 1 or 2 hospitalizations each for extreme dehydration due to cannabis hyperemesis. And the only cure for that, the only way you get that under control is stopping marijuana use. And the only way you can get remission of the psychosis, if you get remission, is abstinence. And that means that's not gonna happen probably without treatment. So we'll move into that in a moment. What I want to show you is, as parents, you need to know what are the short-term effects of marijuana on brain, body, and behavior. Anxiety, paranoia, suicidal thoughts can be common. Learning, attention, and memory problems, distorted perception of sights, sounds, time, and touch, poor coordination, motor skills, increased heart rate, and in some cases, these recurrent episodes of severe nausea and vomiting. And long-term effects of repeated marijuana use during adolescence has a higher risk of a marijuana addiction and reductions in adult IQ. At least 2 studies have shown that, which may or may not be permanent. And let me wrap your head around this. The reductions that have been reported in the literature, about 6 to 8 points of reduction from childhood to adult IQ. And I used to speak a lot at public health symposia, and I couldn't figure out, why is this message not penetrating? Because there was no one in the audience recoiling with revulsion saying, oh my God, that's a public health crisis. And so I thought, well, what would help this message, these data penetrate more? And I went back to the old environmental lead exposure literature, and I found it. 10 micrograms per deciliter of exposure to environmental lead is associated with about a 7.4% point reduction in your adult IQ, and that's permanent. 7.4, 6 to 8. People, we have Flint, Michigan, everywhere in this country right now, and very few of us are saying this is a public health emergency. Our kids are they're not going to go as far in life. But that's really what the research shows. Long-term learning and memory problems. If heavy use begins, certainly it helps and you regain some of those cognitive deficits if they stop using. But to achieve abstinence after chronic use for so long, it really takes a dose of treatment. And a risk for chronic cough, bronchitis, a risk of schizophrenia, or yes, it may precipitate the onset of schizophrenia in those who have a risk factors for schizophrenia, earlier onset. That's not trivial. They might have developed it ultimately, but an earlier onset of such a severe illness has a worse prognosis than later onset. But this should say risk of psychosis, because even those without the genetic risk for schizophrenia are at risk for a first episode psychosis, especially if using high potency. In rare cases, there's recurrent episodes of that severe nausea and vomiting or hyperemesis syndrome, and it increases the risk of becoming addicted to other drugs tried later. Kids who regularly use cannabis are more vulnerable to risk of addiction, have increased risk of addiction to opioids and other substances. And cannabis does have a withdrawal syndrome, and you should be aware of it. If any of your teenagers or ones you know have cannabis and then they're in a restrictive setting, or they go on vacation with the family and can't get it, they're likely. About 35% of kids who use regularly can experience withdrawal if they don't have it. And it's similar to nicotine withdrawal for those of us who've had experience with smoking and trying to quit. But irritability, sleep problems, anxiety, decreased appetite. Some GI symptoms are common, like just hypermotility, diarrhea, some GI symptoms and discomfort in other areas, like kind of flu-like achiness is described. And the symptoms are generally mild, but start to peak about 3-4 days after you've stopped, and then slowly abate and gradually disappear in about 2 weeks. You should be aware that that's what that looks like. And that's uncomfortable for many people, quite so, that it puts you at risk for that abstinence syndrome, for relapse, even if they're trying to quit. Changes in, how can I tell if my child has been using marijuana? Changes in mood and behavior, a change in their peer group, hanging out with a somewhat more deviant peer group, or culture, everyone's smoking marijuana, in my group. Changes in grades, meaning usually decline in grades, academic performance, maybe, wow, he's truant for the first time and hanging out in the parking lot smoking marijuana. Loss of activity or interest in favorite activities. This is very common, and it's associated with what we used to refer to as amotivational syndrome. It's no joke that marijuana can cause that. I hear kids tell me all the time, it's like they just stop caring about much of anything except getting high. Things they used to like before, they don't even recognize the person they were when they cared about soccer or football or whatever it was. They just lose interest, and they aren't really motivated to get off the couch and get a job or get their driver's license or do the things they previously were motivated to do. Changes in eating and sleeping habits, getting into more trouble in school and with law enforcement. Those are the signs. Also, how can I tell if they are if they're using? It's often, giggly, uncoordinated. Think of a Cheech and Chong movie, really. Bloodshot eyes are really telltale, and if they're increasing their use of eye drops, frequency of eye drops, that's a concerning sign. They're having trouble remembering things that just happened or happened yesterday. Drugs, finding drug paraphernalia in their rooms, or strange smells in their clothes and bedroom, or they're using incense and deodorizers to cover up those smells. Posters, clothing, and jewelry that you see around that's promoting drug use or cannabis or marijuana symbols, and unexplained lack of money or extra cash on hand. Keep the doors open for communication. Here's the trick for parents. Here's the tricky part. It is you have to clearly set out the expectations about drug and alcohol use. Here's our family rules. Here's our family stance on drug and alcohol use and the consequences for not coloring in the lines. But on the other hand, you also have to make it safe for your kids to come to you and tell you the truth. So be a good listener, set clear expectations about drug and alcohol use, including real consequences for not following the family rules, and help your child deal with peer pressure. How is it at school now? Or now that you've started high school, what's the culture? How many are using? People offering it to you? How many of your friends use or don't use? Know who your child's friends are and their parents. And parental monitoring is key. Where are they? What time are they supposed to be home? Are they doing that? And supervise teen activities. Check in and talk to your kids often. Make it safe to tell the truth while setting expectations. And parents, that means modeling what you preach. And one of the things I really want to recommend is, if you don't know about it already, is the National Institute on Drug Abuse puts out an amazing array of really solid research-based facts and information about cannabis and any other substance you want to know about. It's in a readable, easy to digest way, but it's research solidly tethered to research and science. And so I would recommend that all of you go to www.drugabuse.gov. That's the NIDA website. You can download these for free. Excellent information for parents. Marijuana, facts parents need to know. Translated into Spanish, and I think they're working on other languages as well. Marijuana Facts for Teens is amazing. And also they have a lot of different activities that are kind of gamified in some ways, like Jeopardy or whatever, for teenagers to use online. You look into it. Do it with your kids. So another thing I want to kind of circle back to is, for example, in Colorado, in general, the states that have legalized both medical and then recreational cannabis have and Colorado's no exception, have among the highest rates in the country for adolescents 12 to 17 starting to use marijuana. For example, here's Colorado. Yep, we are in the highest quintile of states for kids this age range starting to use marijuana. And the starting age average is around age 14. That's the average starting age. Many start earlier, some start later, but that's important because anybody who starts before the age of 17 is doing the thing interfering with adolescent brain development. Colorado's the highest initiation of use, the higher prevalence of use in a state usually translates into a lower perception of risk. What's the big deal? In Colorado, we're among the lowest states for perceived risk of using, at least once a month or even more regularly, low perceived risk. Low perceived risk does not match up with the research, as I've been mentioning. So I'll kind of start winding down and close with this. So I'm okay on time, it looks like, Laura. About 5 or 7 more minutes, and I need to plug in my computer. So let me do that. All right, so substance use disorder, you should know there is a difference between, and you can find evidence-based treatments. We have treatments for substance use disorder, we know, with proven efficacy, proven effectiveness. Some of them are family-based interventions, like, and you may have heard the names of, multisystemic therapy, multidimensional family therapy, functional family therapy, there's brief strategic family therapy, and there are others. There's also cognitive behavioral therapy, CBT, or usually that's combined with motivational enhancement therapy. The reason is because you've probably noticed, if you hang out with teenagers, that this does not work for teenagers. Don't you think you have a problem with drugs, kid? You have a DUI, that doesn't work. You have to use motivational enhancement or motivational interviewing. And so that's why effective cognitive behavioral therapy inextricably integrates motivational enhancement approaches. And then there's behavioral therapies, such as contingency management. This is based in principles of behavioral reinforcement. This works across species, people. I mean, if you reward a behavior right after the behavior, if you reward a behavior, you will increase the frequency of that behavior. If you withhold, reward, or punish, you'll decrease the frequency of that behavior. And that is true in humans, in non-human primates, in dogs, in elephants, probably every species except cats, right? Cats set the contingencies for the rest of us. We know that family-based interventions, on average, they're about 3 to 4 months long usually, and that's how long it takes to change a behavior that's become chronic and entrenched. About 20% or fewer achieve abstinence during treatment. If you do motivational enhancement CBT, about 30% achieve abstinence during treatment. And if you add contingency management, rewards for negative urines, mostly, rewarding that, you get about 50% achieving abstinence during 3 or 4 months of treatment. You might say, wow, that doesn't seem very good. But even when you look at it more granularly, we also see that even those who don't achieve abstinence reduce the use of whatever they're using by at least 50%. And that's harm reduction. Similar to if you smoke a pack a day of cigarettes and you cut to half a pack a day, even if you still smoke every day, that's still harm reduction. However, here's the issue. Here's the issue. These treatments, they work for substance use. But as I mentioned, most of the kids who have a substance disorder have at least one psychiatric disorder, commonly conduct disorder, depression, anxiety, or ADHD. And when I started in the biz, my research career, I could see that cognitive behavioral therapy is on the list of efficacious treatments on this side of the house and this side of the house. And so when I began doing my own research, I chose cognitive behavioral therapy as the background substance treatment in kids who I was going to then evaluate what happens if you treat the ADHD, the depression, while they're also concurrently receiving substance treatment. My goal in life was to improve the treatment for co-occurring disorders and develop better treatments for those kids who are the rule, not the exception. Everyone agrees, NIDA, SAMHSA, Cochrane meta-analyses, the most effective treatment we currently have for cannabis use disorder is this right here, MET-CBT plus contingency management. So keep that in mind when you're looking, if you look for treatment. The problem is these treatments here are not integrated with treatments for the co-occurring disorders. And that was just wrong because NIDA, SAMHSA, everyone is a pretty strong consensus that the best treatment is integrated treatment with for individuals with co-occurring disorders, and recovery depends on treating both, and combined treatment is best. Ideally, combined mental health and addiction treatment from the same treatment provider or at least agency or team. So where can I find substance treatment for a teen who needs it? Evidence-based. Well, SAMHSA, the Substance Abuse Mental Health Services Administration, SAMHSA, has a hotline, and they also have a very nice resource list on their website of where you can find treatment in various states across the country that are evidence-based, the ones I listed on that slide. And then just last month, this is great news, just last month, SAMHSA published a new evidence-based resource guide series, treatment considerations for youth and young adults with serious emotional disturbance and serious mental illness and co-occurring substance use. Thank God. And I'm pleased to say they featured Encompass, our integrated treatment, in this guide. And there's some other, treatments that move towards that goal too, integrated treatment as well. I will stop there and I'll stop sharing my screen and open it up for questions. Let's see, what do I do here?
All right.
And how do I, you can probably control it from here, Laura, or can I see, I can stop sharing.
Yep, you can stop sharing your screen.
I see the menu now. Hold on one second. All right, sharing. I don't want to share. I'll stop.
Stop showing screen.
Stop sharing my webcam.
No, webcam, keep up.
No, keep that. Don't click
showing screen. It's in the section above it under sharing.
Okay. Sharing and stop showing screen. There we go.
Perfect. Now you can see me again, right?
Yes, I can. Thank you.
Okay, wonderful. So, wow. That was fast and furious. That it's amazing and awesome. And my reaction, just in that last slide that you put up, is why don't psychiatrists, counselors, therapists, why don't they have this information, Paula? You know, Johnny went to a psychiatrist who told him, who didn't tell him to stop smoking. We were really wanting the psychiatrist to say, don't use marijuana. And guess what she told him? She said, you should use something a little less alerting. How about switch to an indica strain with less THC? I was so upset.
So you're right. So Laura, I have to say, I'm becoming, I thought it was about educating just parents or folks who aren't scientifically or medically trained. I'm stunned as I've increasingly collaborated with pediatricians and other mental health professionals, including psychiatrists in my own field, how the extent of they don't know the research. And for God's sakes, the minimum, what we owe our patients is to give real psychoeducation based on research to patients. And they don't know it. That's why I'm writing as much as I can right now and speaking as much as I can. And then it's right there. It was a click away. NIDA has all the resources you need. You don't have to read a lot. Just read the bulleted insert. Here's the real. You can't. A colleague who treats kids said recently on a panel, he said, yeah, they don't want to stop. So what's a safe level? And he started off by saying, yeah, if they cut down to maybe a few times a month, it's like, wait, I have to disagree with my colleague. There is a safe level of marijuana use in adolescents, and it's their decision what they want to do about it, and there's treatment. But I have to tell the truth. That's what the science says.
Well, and so many parents who are snowed by, you know, this Trojan horse, you know, kind of medical marijuana, sadly, are giving their children the marijuana because they have been told by this false narrative that it helps with their anxiety. It helps with their depression. And the parents are unwittingly often facilitating the very mental illnesses that you're speaking of and saying, oh, it's not working. What level of medication should I be giving my child?
Well, in the industry, well, it's all of that is out there, and you would think this is a benign recreational drug, and besides that, it's medicine too. And you know, I don't have a dog in this fight other than science. I mean, so if you care to wait false info or the information coming in, I go to the research. It's peer reviewed, and that's where you can find that is at on the NIDA website. And that's all I know to say, because
okay, and we did provide those two handouts on this page where people are clicking play. They can find those two handouts you sent from NIDA. So thank you for that, and hope they read all of those. But I just don't know what it will take, you know, besides people like you going to conferences at healthcare professionals, doctors, therapists, counselors, and telling them this. It's like, do they not read? Do they not?
It's an interesting thing, Laura. What happened is this is one of those unusual things where medical marijuana, it came from the industry and into medical. Usually medicines or a medical indication for a treatment comes from the medical community, from our research, and we go get FDA approval and we say this is safe and approved, like the vaccine efforts or the whatever. That's the way it goes, except in this case there's an industry that has a stake in selling it, expanding the use, and they don't care about the person who uses once a month in their basement. They want you to be like Starbucks with a punch card. The more you use, the more you get a discount, you know, a user's discount. So the medical, it was political and kind of industry forces and advertising that drove their economic, that drove the medical. And you can see videos and films from the 60s and 70s that show that was their strategy. We cannot go straight to legalizing marijuana. We have to go this medical route first. And then within 2 years, those states that bite on that, we know that they're ripe for recreational legalization. That was a marketing strategy from they developed in the 60s, in the
And we'll
70s.
probably hear the big cannabis executives in how many years saying in front of Congress, oh, it's not addictive, just like they did with big tobacco.
This is big tobacco on steroids. Yes.
And how long do you think, Paula, because, and I know we've talked about our son Johnny's story, who had psychosis and died by suicide in, exactly the path that you just described, sadly. And it was just a train, and we couldn't get the healthcare figured out. And we had so many doctors and treatments and mental health, hospitalizations and, transcranial magnetic stimulation. I mean, we did everything, and then had to do antipsychotics and, but I can't find the doctor who, when my son was 18 and in college, as well, who could get a med card the month when he turned 18, and he never had a problem in his life. So all he had to do is say, he had a migraine or whatever he ended up say. It seems almost criminal. It seems very much like,
Almost criminal?
the pill mills.
It should be criminal, and someday it may be, but you're right. It's just criminal. I think it's a public health emergency based on the numbers I see. I mean, just what else would you call this? But
Legally being able to go at 18 years old and buy shatter, and he did get psychosis, and it did go away with abstinence, but he would go back to it, and eventually it converted to more of a schizophrenia and needed antipsychotics.
a chronic psychotic picture.
Yeah.
That's
And
exactly.
then once again he got better. So there's this weird gap between 18 and 20 where now they can't get cigarettes, they can't get alcohol, but you can go buy vape, at 90% THC, and then they're selling it to the rest of the high school and even the middle schoolers, and it's legal. You can go get a med card and go buy. Well, it's illegal to sell it, but they don't have to get it from the black market. They just go to a dispensary.
That's exactly right. And it's very high potency and very dangerous. And the dispensary person who's standing there in a white coat as if they're a ancillary medical provider. Is it, let me show you, what do you have? Anxiety? Use this indica and this one and this. And I mean, it's appalling. It's
Or
really,
telling pregnant women it will help them with their morning sickness and other
and
things that
we
are
have
causing.
clear data that it's fetal, it interferes with fetal brain development. I know.
Let's
I
see,
know.
someone has a question here. What info do you have on edibles? Someone's interested in hearing more about your comments on edibles. What is legalization doing with additives to drinks? I mean, are you seeing just every format in your work, Dr. Riggs? I mean,
Well, it's not my work that's producing those things.
No. In your work
Yes.
of treating children, are they coming
Yes.
in using every form of,
Absolutely.
edibles? She's asking specifically about additives to drinks. That
I don't know about the additives to drinks, but the problem, one of the problems with edibles. So, oh boy, I was on the panel before we rolled out. We passed legislation to recreational legalize, but before we rolled it out and started opening the stores, I was on a panel, a state panel for, hey, what should the regulations be? What should be on the label warning?
okay.
I mean, there were also scientists and researchers like myself, but there were also dispensary owners and industry reps on this panel. It's like, what? Okay, all right. But I said, well, at the time that an article just came out about little kids being hospitalized for getting edibles off the floor from their high parents. You can't tell a gummy that has THC in it from a gummy that does not have it. And they were being hospitalized sick as stink, not to mention the vets who were seeing pets who were toxic from cannabis. And so I go, guys, I said, could we revisit packaging of edibles? Because to package edibles in ways that are incredibly appealing to young children, like Butterfinger or gummies or candies, and you can't tell the difference. Yes, you take them out of the store and they're in some kind of a package, but you know, you empty them into the bowl and they sure look, they're just like candy. To package edibles like that, um, uh, we should rethink that. Are we going to allow that? A dispensary owner at the end of the panel said, you know, adults like brownies too. It's like, I'm sure. But we're talking about cannabis. Surely you don't want, little kids are being hospitalized. I know 2 on a ventilator right now in the ICU. If we say we're okay with packaging this in ways, little kids can't read warning labels. They cannot.
Right.
And they can just see gummy, okay, it's on the floor, gummy. So can your pets. So it's like, if we say we're okay with packaging this as a consensus, then that means we're okay with ongoing number of kids being hospitalized. That's what happened. They said, Dr. Riggs, what should the warning label look like for cannabis products? And I go, well, based on the research, and I'm a psychiatrist, there were OBGYNs there. It's like, y'all aren't saying, I said, at a minimum, it should say women who are or may be pregnant should not consume this product. That's fair. That's based on the research. There's no research that says otherwise, and a lot of research that says women who are maybe, it didn't make it to the warning label. You tell me why.
That's disgusting.
You tell me it made it to the warning label in Washington State, did not make it to the warning label in Colorado. So you have to
Because
realize
big pots in their pockets, and it's a profit, addiction for profit industry, and our regulators can't see past that.
and our legislators. So think about it. If only 52% of our, that was the majority, voted to legalize recreational. Okay. But once the voters have spoken, it's also political suicide if you're an elected representative to look like you are trying to, in any way, even the appearance of interfering with the growth of this new industry that the voters have said they want. And therefore, it makes it very difficult to get legislation passed with stricter regulations. I mean,
We were at the Capitol, my husband and I, about a month ago, speaking to the Senate Minority Leader and one of our representative in Highlands Ranch, and they just, oh, nothing I can do. They changed the Constitution. It's legally protected that 18-year-olds can get it, and they just, act like a victim almost of the public. We can't lower THC potency. We can't put guardrails around it. We can't put marijuana monitoring programs in place so 18-year-olds can't loop from place to place. We have to require 18 to 20-year-olds to have a PCP approval when they get, all of these things could be done. There's much that
oh, yes,
could be
countries
done.
like Uruguay, Ecuador, they have said no higher than 15% THC. They said a limit. We went to the legislature and said, please pass this legislation, at least keep it in the box, because we could see 80, 95% THC. Really? Who needs, I mean, and they actually laughed at one of the people who testified. I mean, so that's where we are. We
Well,
just,
I don't know how many generations of young people we're going to lose, Dr. Riggs, before like big marijuana and big pot. How long was it in big tobacco before 60 years before?
alcohol, if you think people say, hey, is marijuana, is it any worse than alcohol or tobacco? It's like, is that the question? Is that the question we want to, because think about it. Well, in some ways, yes and no. I mean, you smoke marijuana like tobacco, but tobacco doesn't make you high. Cannabis does. Okay, so yes and no, but it is an addictive drug, and when you legalize an addictive drug, it's as if we learned nothing from tobacco and alcohol. But we know that tobacco alone, but tobacco and alcohol combined, cost us more in terms of public health costs, death, mortality, morbidity than HIV, suicide, motor vehicle accidents, homicides, gun, everything in the universe you could pile together, pale in comparison to the cost of tobacco, alcohol, or the related diseases. So it's as if we learned nothing let's do it again, and we will pay that price again, I think.
Well, Dr. Riggs, you have given us so much to think about, to act on, to go speak to our legislators about, information that we as parents and concerned adults can really use. So I will close by reading a comment from a participant who said, wow, that was awesome. I will share and hope others listen to this amazing information. Dr. Riggs, we are so grateful for your work, and thank you for your time and your knowledge, your wisdom, and for giving to Johnny's Ambassadors. We sure appreciate it.
The pleasure. Fight the good fight, everyone.
Thanks so much. Take care, everyone. Bye-bye. Thanks, Dr. Riggs.
You bet. Thank you.